Well, hello. Hi. I'm trying to get some clarity here on my screen. My ring light is acting kind of wonky, so I'm trying to see how I can best adjust it to. I need it better. Maybe this way. Okay, I think this will have to suffice. Hi, guys. It's me, Lynie. I'm part two of my Friday feature session. My first part aired last Friday. And even though I was the guest last Friday, I didn't know that there was going to be a part two. But as a result of what aired last Friday, someone that viewed it contacted my mom, and they said they were concerned because I looked really tired. I didn't look sort of like myself, and they were alarmed by that. And so, as a result of that, I had some conversations with some family members and friends. And um, in addition to having survived breast cancer, I don't know if I've mentioned before in some of my conversations, but I also have uh, some chronic health issues, and diabetes is one of them. I've had it for several years now. And initially, when I got diagnosed, I was doing very well with it. Once I learned about it, got educated, what have you. But as the years have gone on and progressed, uh, I've gone up and down with it. And so right now, I seem to be in a down cycle because I'm just having a hard time uh, getting my sugars to stay in a good range, getting my blood level sugars to stay in a good range. It's either too high. Lately, like this past week, what woke me up in the middle of the night was that I had gone dangerously low. And I woke up profusely sweating. And when I looked at my phone, because I wear the CGM monitor, I was down to blood sugar of 64. And so that was alarming to me. And, it's just several different things going on. I work from home. And unlike when I used to work outside of the house where I would pack my meals, meal plan, and do whatever, oftentimes I just jump up and jump right on my computer and start working. Um, and I noticed that, or rather, let me just say, my mom noticed that I hadn't been eating my breakfast like I normally would, and then working the long hours, maybe coming out getting something really quick for lunch, and it's not holding me or what have you. Just a whole lot of discombobulated stuff. And the long and short of it is, I'm going to take my glasses off so you can see my face the way my sister saw my face, because of course she's the one that called my mom, concerned because of how I look to her. Now, let me say this in the interest of, when people who wear glasses for years uh, take their glasses off like this, oftentimes what you don't see behind the glasses is I do have dark circles under my eyes, but I've had them there for a while. And if I don't have on a full glam of makeup with concealer and stuff like that, you will see them. So um, I'm saying that. But I guess beyond that, she felt like I looked really tired. And I will say, I probably am, because I am a chronic insomniac. And whenever I am stressed, unlike some people that are stress eaters and things like that. Whenever I'm stressed, it really, really affects my sleep. And so, even before breast cancer, I have chronic knee issues. And what came along with the chronic knee pain was insomnia. And so it predates anything. But what I found was that it increased once I was diagnosed with breast cancer. And now, like I said, that is how my body interprets stress. When I'm stressed about things or what have you, I don't sleep. And so I go days, weeks at a time where I'm up until 4:30, close to, yeah, 4:30 ish in the morning. Um, and then I have to get up and be ready for work and clock in at 9. And so, that sleep deprivation I do recognize is impacting my health. And so, my sister made a suggestion that I should make this a part of my channel segment, in that, one, it holds me accountable, because maybe there are a whole lot of other people suffering the same way I am, and just have me become for as proactive and, I don't know what the other word is, as I was dealing with my disease process with breast cancer. Diabetes is just really, it is one of those diseases that it's very challenging to manage and to live with. If you don't have it, you can read all you want about it or whatever and think you just don't know, because it's one of those things. Sometimes you can really, really be doing all the right things, and for whatever reason, stress, other factors, other things happening in your body, you still can be on that wonky cycle. And it's one of those diseases that tends to, the longer you live with it, the more frustrating the fight is that you have with it. And so, I do and have seen and witnessed within my own family the negative effects of diabetes, and what it can do to the body. Just recently in June, I'll share this as well. I decided I wanted to treat myself and have a great day. I hadn't done something like this in a while, and I decided I'm going to take myself out. I might get a little emotional about this because this is just emotional for me, but take myself to treat myself and go to um, the nail salon so that I could get my hands and my feet done, because I hadn't had that done in a while. And so, it's one of these places, it's very big. They got this whole process where you're at this one station for a bit, then you go to the next. Okay, so it was that type of thing. And so when I got to the station where I'm waiting for the guy to come do my pedicure, of course, they have me in the foot, can't even think of the name of in the chair. They have me in the pedicure chair. And so I'm soaking, waiting on the guy. And I mean, I'm really having a grand day. I'm on my cell phone talking to different ones of my friends and what have you, saying where I'm at and what have you. The guy, when he finally comes to me, he does a great job. I think my feet look great. Matter of fact, my toes are still polished from when he polished them, and the nails have grown some, but the polish is still beautiful. But when I got home, all of a sudden, when I looked down at my legs, I had these blisters on my legs. And I'm like looking around, and blisters are popping up or what have you. And then I realized the water must have been too hot and I couldn't feel it. I sat there all that time with my legs burning and I couldn't feel it because of evidently the desensitization in my legs, which I did not know of until then. I knew that diabetics had to be really careful with their feet. They always check your feet, your sensitivity in your feet. But I had no concept that it also applied to my legs. And so it has really bothered me because, nothing like that's ever happened before. And so I had these blisters all around, and I'm thinking, okay. But then as the weeks went on, I started noticing, just more blisters all around, even small, fine ones all around down the ankles and stuff. And then my ankles and everything were looking very dark. And I was like, so I realized I must have been burned worse than I thought. So I finally went to the doctor yesterday, and so I'm telling him my concerns or what have you. And and so he looked at it and he felt like I didn't need to go to wound care because I had been treating it and everything looked like it's healing and whatever. He, of course, was upset that it happened. He said it was very unfortunate that this happened. He said because that is one of the things diabetics have to be very careful of because of the fact that you can lose sensitivity in your legs and stuff for the nerves or what have you. So What a terrible way to find out I've lost it, because my legs have been burned. So anyway, so we talk about, just some other issues, me not sleeping, just stress from work, what have you. And we came up with a game plan. And one of the things was that I immediately, 2 days ago, when I found out how upset my family was by them thinking I'm gonna stroke out or what have you, um, is that I decided to just get back to basics. Have my breakfast, have my lunch, have a sensible dinner, or what have you, and just see how my numbers go, what have you. I have an insulin that I have been taking. It was relatively new to me, and I hadn't realized, and maybe my provider thought she communicated it to me, but she hadn't, that she had increased the dosage. So part of the problem could have been that I was still taking a lower dose when I should have been taking a higher dosage. And on my end of it, just being very diligent and fastidious to take the dosage as prescribed. So to take it 5 minutes before I begin my meal. Um, and so I did that yesterday and today, and it's just been perfect. My numbers have been blowing my mind. They've just been so great. I mean, numbers going steady across the board, just like it. Not these spikes, not the lows, because both are not good. And, it's just a horrible feeling when, especially with the lows, you in a sweat, you're clammy, or what have you. And you're just nervous and in a panic, because I was sitting on the bench yesterday, coming from the doctor. I dropped low. I did eat breakfast, I did eat lunch, but I probably didn't have enough protein and stuff with the lunch to help sustain me. And so, sitting on the bench, I'm out there waiting on a ride, trying to beg people for a piece of candy because I had nothing with me. And so, it's just this whole discombobulated way that this disease is impacting my life. And so I know I really need to just pull it together. I know I could tell a dietitian and all that kind of stuff how I'm supposed to eat. Um, and it's just a matter of, again, putting yourself first. Uh, I want women who are going through a disease process to definitely practice self care. And so, to be authentic in that, I have to practice self care myself. And so, even though I'm not fighting one battle, I have another battle to fight. And so, to continue to practice good self care would be to really take charge of this disease process and try not to allow it to rob me of any more of a quality of life. I think when I first was diagnosed, because my father was a diabetic from the age of 42 until he passed away in his 80s or late 70s, I'm sorry. And I can remember how he found out that he was diabetic is that he dropped like maybe 40 some pounds in a 2 week period. And when he got to the doctor, whatever, and they ran some tests or whatever, they found out that he was diabetic. And, um, there were many, many years due to my father's health situation that we were caregivers and like active caregivers where we had to be at the house to help look out for him, take care of him. And he was a 3 needle a day uh, insulin dependent diabetic. And when I was first diagnosed with diabetes, that's all I remember was, having to give him or having to prep his needles and then having to give him his insulin shots. And I was terrified because I just didn't know what that meant. But early on, one of my providers helped explain to me, actually insulin is just, um, it's just a hormone that we need in the body to help us process the glucose and stuff that's coming into our system. And so looking at that made me feel somewhat better about it. But initially, in the beginning, it was just I was treating it just with pills and watching what I eat. And so gradually, since I said I've been dealing with this for some years now, it has progressed to now where I'm having to use long acting insulin at night. And now, because I kept having the up and down spikes, up and down, the highs in the mornings and all that kind of stuff, my provider then added a fast acting insulin to take with my meals. And so, and then looking at my legs and stuff, I'm like, I feel like I'm becoming my dad. And so, it's just really, it's just dealing with a disease process, whatever it is. It's a lot. It takes a lot mentally. It takes a lot um, emotionally to continue to, you know, fight the fight, so to speak. Because some days you feel like just throwing in the towel. You feel like you don't want to take another pill. You don't want to do another shot. You don't, But having this week um, happen, I recognize when I'm thinking like that, I'm not really thinking about the other people that are impacted by the choices I'm making or not making. Because sometimes not making the choice is making a choice too. When you choose not to do something, that's still a choice that I've made. And so, and this week has helped me to appreciate that more people besides me are impacted when I make or not make those choices. And so I am committed to myself and to really try to get in front of this as much as I can, because what I recognize is the longer you stay in a pattern with diabetes of I don't want to say non-compliance, because it wasn't that I wasn't compliant. I just wasn't doing things the way I should have. I wasn't giving it enough attention to take some of the medicine the way had been prescribed or what have you. So redirecting my focus and my attention so that I can fully understand and commit to how I'm supposed to work with the medications that I've been given, work with a diet that will help the medications that I've been given help me. And the hopes would be that in the process, it would help me be healthier. I could lose some weight and maybe eventually not be dependent on the medication. But for now, because I do want to do the best for me because I deserve it. And this is what I recognize. And so this was my part two. One, to be accountable to the audience. We're trying to encourage and upbuild one another, because here at the Pink House, we do grow strong women. And it takes strength to deal with any disease process, because nobody wants to be sick. Nobody wants to think of themselves as sick. Nobody wants to be in that category or tick that box when you filling out a form or what have you. So it just you can't escape it. It is a part of who I am at this point, and I just have to embrace it and deal with it. I look back to how I was initially. I was a star for my providers when I would go back, and they were so proud of the weight I was losing, how I was managing, my diabetes. And then certain things in life happen that, you get off track, you deal with disappointments in a different way. And oftentimes it does impact your health, if things didn't go right the way you planned something or what have you, oftentimes you internalize it and it impacts your health. But I'm really, really committed to one, a better regimen with my diabetes, and two, well, I should reverse it because I think one is more important than the other, a better regimen when it comes to my sleep. Like yesterday, I turned in earlier than I have in a long time. And I think it might have been like maybe 12:40 or 1. That is great for me if anybody knows me. And so my mom said to me today, she said, you felt rested after last night, didn't you? And I told her, yeah. So yeah, I just wanted to uh, be authentic, um, and the same way I'm asking you to share pieces of yourself when you come on certain segments or what have you, and we learn and grow together. Um, this is me saying to those out there that watch my channel that like it, um, you know, making myself accountable to you, um, because it's just, it just is what it is. And I wanted to make myself accountable because, you know, how can I help women if I can't help myself? And so I'm determined and committed uh, to being one of the first strong women that the Pinkhouse is growing. And that's to help me be strong in every aspect of my life. And so this is just the disease process that I have to deal with. And I know it can be done, and I know I can do it. Um, you know, not afraid of the challenge. And I just had to reassess. It was as its title, it was a wake up call because, again, you just don't realize sometimes uh, how your health choices or the things that you do or don't do that it impacts other people besides you. Yeah, and so that's what I wanted to share with you guys, and just hopefully you'll be out there rooting for me and be encouraging, and I'll share with you how I'm progressing. Like I said, today was a great day. My numbers have been perfect all day today, and I mean just a steady, even keel across on my monitor. No spikes up, no spikes down, and so that has even been encouraging to me to see what my efforts throughout the day has already done. And so that's my goal, to try to maintain it day by day. Take it one day at a time and just try to maintain it day by day. And so thank you for watching, and I'll see you next time. All right.